Good morning, everybody. Hi. I'm going to wait a few minutes for some of you to come on live, but if you are just joining me, I want to take a second to introduce myself. My name is Dr. Mary Claire Haver. I am a board-certified obstetrician gynecologist. I am also a culinary medicine specialist, which makes me an expert in nutrition, and I have married my passions for women's health and menopause and nutrition into my program, the Galveston Diet. But today, I want to talk about some breaking news in the menopause medical world. I seem to have fallen on the controversial side of menopause talk, Menotalk. There are some anti-hormone replacement therapy folks out there who have found my page and are doing some reporting, and I mean, that's okay. That's your right. But I come with receipts. I have the evidence. So today I want to talk about a study that was just released. And it really is some breaking news. This is the first time that I have ever heard this information having to do with menopause. And it's really, really, really exciting. So this is from, let me pull up the article. This is from the Cancer Journal. So when we look at the validity of different medical journals, the Cancer Journal is one of like the top in the cancer world. It's funny because the information, so let me see if I can show you guys if it's gonna, so here's my laptop, here's the journal. So of course I use PubMed for everything. Is it backwards for you guys? Probably. Yeah, and I can't flip the screen in video, but it is from the Cancer Journal. It came out just now, May to June of 2022. I thought that this information would be on Good Morning America, would be on all the morning talk shows, would be absolutely everywhere. So I'm a little bit shocked that I haven't seen it or really seen it touted. I do surveillance on new menopausal articles as often as I can, pretty much at least 3 to 4 times a week. And so I was really excited to see that this particular article got released. Now, some of the data I'm going to present has been presented before. We have known for a while that the all-cause mortality risk. So when we look at 2 groups of women, those who choose any form of hormone therapy versus those who don't, there are certain things that we know that are evidence, absolutely proven. Women who choose hormone therapy have a lower all-cause mortality, a lower risk of death, from any cause than women who don't choose it. They also have a lower mortality risk from cardiovascular disease and all causes of cancer. That is a proven fact. You can argue it up and down. Again, it's looking at populations, not at individuals. And again, not everyone is a candidate for hormone replacement therapy. It also depends on when you start. So the earlier you start, the better. Not that an older patient is not a candidate, but she's not going to expect the same health outcomes as someone who started around perimenopause and early in menopause. So this was found so if you go to PubMed.gov, somebody type it out in the comments, please. Menopausal hormone replacement therapy and the reduction of all-cause mortality and cardiovascular disease. It's about time and timing. It came out in the Cancer Journal this month. It just came out. So if you guys have questions, please, there's an interact button. I think they took the Q&A button below. So let's see. Are you on HRT? I want to know. Are you on hormone replacement therapy? How old are you if you are watching? Are you female? Are you menopausal? Are you perimenopausal? And are you on hormone replacement therapy? Have you discussed hormone replacement therapy with your doctor? Have they discussed it with you? I am working, PubMed.gov. Thank you so much. So this article talks about, so if you're just joining me, I'm getting notifications from TikTok, so hold on with me. I am Dr. Mary Claire Haver. Yes, I'm in my pajamas. I am having coffee. I just did a TikTok video, so please go watch it. I'm Dr. Mary Claire Haver. I'm the board-certified obstetrician gynecologist. I'm also board-certified in culinary medicine, which makes me a nutritionist. In medical nutrition, I am married my passions for women's health and menopause and created a nutrition program to try to optimize wellness. You can go check that out at galvestondiet.com. But today I am talking about menopause, specifically a new article that has been released just this month. talking about menopause and hormone therapy and outcomes of women who choose hormone therapy versus not. There is a lot of miseducation, misinformation, and fear mongering out there in the population, and a lot of doctors have not kept up with the latest studies, and they are dismissing patients, not offering, or even every single one of you deserves the right to be able to choose hormone replacement therapy. You can choose not to do it. That is your right, and I support you 100%. But 100% of you should be having an in-depth conversation with your healthcare provider as to your specific needs, risk, benefits, and what the potential outcomes are for you if you choose hormone replacement therapy versus those of you who don't. Okay? Those of you who don't. If you are looking for a menopausal healthcare provider, it is hard. It's not easy. We're not all trained the same. We don't all believe the same. And a lot of people, it's hard to prescribe hormone replacement therapy. It requires a long conversation with your patient. We're not paid for time in front of the patient. We're paid to get patients in and out in most traditional practices. So with your help, I have compiled a list of your recommendations, yours, my followers. I've got millions who are like, look, I went to this person. They were the bomb.com. I love them. They talked to me. They did it. So if you go to Dr. Mary Claire up here, so please like this video. So just double tap the screen. I'm so sorry. Double tap the screen to like the video. That will help drive engagement and make me more relevant on this platform. So you just take your finger like me right here and you tap on my face. Just tap on my face 10 times, everyone. And that will drive the likes and make me more relevant on the platform for a 53-year-old, mom. It's kind of hard to stay relevant on this platform. So I really, really, really appreciate your support. So if you don't follow me, follow me. Absolutely follow me. I have a shit ton of amazing information that I give out absolutely for free on this app, on YouTube, on Facebook, on Instagram, because my mission in life is not to sell diets. My mission, I do fine with that. I totally support my family. It's fine. My mission in life is that every single woman gets the conversation she deserves and the opportunity to choose hormone replacement therapy if she feels like it's going to work for her. That is my mission in life. So please help me spread this mission. Follow, share. Thank you for the roses. Thank you for the hearts, everything. So the article I'm talking about right now, today, if you want to look it up, it's at pubmed.com, okay? And the name of the article is Menopausal Hormone Replacement Therapy and Reduction of All-Cause Mortality and Cardiovascular Disease. It's about time and timing. I'm going to flip the screen so you can screenshot this if you're on your phones, okay? So here we go. I'm flipping the screen right here. I know it's backwards. I'm so sorry. You can do some magic. Screenshot this. Screenshot this so you can go look it up and read it on your own. This is just the abstract, but it's got all the important information there, okay? I'm going to hold it for 10 more seconds. Screenshot this so you can do your own research. This is from the Cancer Journal that just got released, okay? PubMed is free, open to the public, and you can pretty much read any abstract that you want. Thank you, everyone, for the likes and the shares and the follows. I really, really, really appreciate it. Okay, so everybody screenshot that. I am going to summarize this. Yes, you need hormone replacement therapy. Yes, you do. Yes, you do. Stop. You can choose not to do it, but you are putting your life at risk. Your health is at risk if you choose not to do it. Okay, so the totality of evidence, let me tell you, is that hormone replacement therapy affects, the earlier you start, the better. The earlier you start. So starting in perimenopause or at the very beginning of your menopause is critical, okay? Hormone replacement therapy significantly reduces all-cause mortality, meaning death from any cause. You have a lower chance of death if you choose hormone replacement therapy. You have a lower chance of death, okay? You have a lower chance of cardiovascular death if you choose hormone replacement therapy. You have a lower chance of all-cause cancer death if you choose hormone replacement therapy versus those who don't. So women who don't choose or are not offered or not given, it wasn't their choice, they were never given the choice, then I'm going to get into the risks and who's not a candidate. And a lot of you are typing in your medical conditions. You're still a candidate. Your doctors are lazy and they're not, your doctors are lazy. They're choosing to do menopausal care, but they're not keeping up with the latest research. So, okay. The earlier you start, the better. But here's what I want the take-home message to be. And please, everybody pay attention, okay? Hormone therapy is more effective than a statin. A statin in a perimenopausal woman will lower your cholesterol, but it will not change the risk of you having a heart attack and dying. Statins are not helpful for women. This is the problem when we only test on men. And if you follow me, you know that a lot of these medications were only tested on men and the data was extrapolated to women. Okay? Statins are not helpful for women to reduce the risk of cardiovascular disease. What works better is hormone replacement therapy. Hormone replacement therapy is more effective at lowering your risk. Now, how many of you are on a statin for high cholesterol and have never been offered hormone replacement therapy? How many of you? Anybody out there? I'm waiting on the comments. So, you are. Okay. Were you offered hormone replacement therapy? It is more effective of lowering your risk of a heart attack, of death from cardiovascular disease, than the statin they put you on. This is absolutely right. This is absolutely fact. Okay? And you were never discussed hormone replacement therapy. You never. Print that article out and take it to your cardiovascular doctor. Educate them. This is a new article that just came out in one of the most respected journals in the United States. You may have to demand hormone replacement therapy. If you're looking for a good menopausal doctor, they are hard to find. If you go to Dr. Mary Claire, click up there. At the top of my TikTok page, there is a link in bio. Click on the link. It'll take you to my little link in bio page. There is a menopause doctor referral. You can go and see if there's someone in your area that my followers, of which I have million, have recommended. These are doctors. I have verified that they're physicians and they're open, but that they are recommended by my followers as being good menopause. We do have a few in Canada and we have a couple in the UK. We're working on a more international database, but they're mostly in the US, okay? HRT does not put you at higher risk of cancer, okay? Actually, being on a statin puts you at a higher risk of cancer. Did you know, of breast cancer? Did you know that? Putting you on a statin puts you at a higher risk of breast cancer. So if you're looking for, and these are recommendations, you can't Google and find me a good menopause provider because everyone's paying for SEO and bumping them to the top. I have gotten personal recommendations, testimonials from my followers who are recommending doctors, or the doctors are North American Menopause Society certified. They've gone through certification through NAMS and they have taken the time to have enough invested and wanted to be a good menopause doctor. So, and if you have a great menopause provider, please, it's the same link. Give us their name and information and a testimonial and we will post it for you. We have a few hundred in there. Again, it's so sad that we only have a few hundred. We are working on more, but we need you to find the good physicians and get a good healthcare provider. If you're in Texas, come and see me. Come and see me. I will talk to you. I can only practice medicine in Texas. Please come and see me. I am outside of Houston. Again, the link to make an appointment with me is up in my thing. But let's see. Yes, there is a rush to put a patient on statins. That was the tried and true, but it actually, statins don't do shit for a woman to decrease your risk of cardiovascular disease. They don't do a thing. The link, please. The link to what? The links are, okay, so any links to, if you want to know if you're in perimenopause, if you want to know if your diet's inflammatory, if you want to know lots of stuff, our blogs, our information, all the stuff free, our meal plans, go check it out. If you go to the link at Dr. Mary Claire, it's there. So everybody take a second, please. If you don't know me, I'm Dr. Mary Claire Haber. Please follow me. Please share. You can share this video with somebody you think will be helpful to. I cannot put links to articles on TikTok. They will not allow me to put any links. You can Google the link on PubMed, okay? You can Google the link. I will show the article again, absolutely. But it's going to be backwards. I can't flip the screen. I wonder if I can more. I wonder because I screenshot it, if it'll let, no. Okay, I'm not that good. Hey, friend. So the title of the article is Menopausal Hormone Replacement Therapy and reduction of all-cause mortality and cardiovascular disease. It's about time and timing, okay? The medical ID, the PMID number is, and somebody wants to type this out, the PMID number is 355-9469. I can flip my screen. I cannot flip the screen in the middle of a video, but I can turn this around so you can see what I'm looking at, but it's backwards. So you can screenshot this and flip it on your camera, and then you can just Google this name. And it came out in the Cancer Journal. It was just released in one of the most prestigious journals in the US, okay? You can show this to your doctor in order to give you one more reason for you to get hormone. I'm holding it here for 5 more seconds. Everybody screenshot this, and then you can flip it in the edit section of your phone, and then go Google it, print it out. Okay, everybody have it? Screenshot this. Okay. Let's see. I am not talking about testosterone. I am only talking about, when we talk about menopause hormone therapy, we are talking about estrogen or estrogen and progesterone if you still have a uterus and not using a progestin-containing IUD. This is nothing to do with testosterone. This is when medicine and OB-GYN literature, when we talk about menopause hormone therapy, the data, the studies, the outcomes only are talking about estrogen or estrogen and progesterone, nothing to do with testosterone. Okay, I just want to be really clear about that. The BioT pellet is testosterone. That has nothing to do with estrogen or progesterone, okay? You're kind of off the reservation there. There's not a lot of studies supporting its use, testosterone's use in a woman outside of desire issues and a postmenopausal woman. So if you are only on progesterone, you probably want to go and talk to your doctor about adding estrogen to it for these potential health benefits, okay? Is synthetic hormone therapy effective? Yes, it is. It is, okay? It is absolutely effective. Let's see. So go ahead and post some questions in the comments. If you're just joining me, or if you're here, take your finger like this and double tap my face. Double tap my face. That lets you to do likes really quick, and that allows me to stay relevant on this platform. The more likes that I get, the makes me more relevant, and they show the video to more people. So I really appreciate your support. It helps me stay relevant on this platform. If you don't follow me, I welcome you to do so. The follows here are kind of critical to, again, keeping me relevant on the platform and keeping me, and thank you for all the gifts. I really, really appreciate it. So you've had pulmonary embolus in the past. Is there hormone therapy available to you now? Yes, absolutely. You are a candidate. The transdermal or transmucosal forms, the non-oral forms of estrogen, are going to be your best bet because they do not increase the risk of stroke or blood clots, even with the history. So, now, a lot of doctors haven't kept up with the latest research, and they'll tell you blanket, no, absolutely, you're not a therapy. High blood pressure is not a contraindication to hormone replacement therapy. It's not. Okay, well-controlled hypertension is not a contraindication. Your doctor needs to keep up with the latest research. Your doctor needs to read, okay, in order to give you the best health outcomes. Let's see. Age that it's too late. That is really controversial. The maximum health benefits are starting younger, okay? The younger you start, the more you're going to maximize your health benefits. This I can tell you. Women who were on hormone replacement therapy for 10 years, starting at menopause, so up to about age 60, because the average age of menopause is about 51, had no increased risk of stroke, no increased risk of breast cancer, and no bad outcomes. They actually lived longer, had less all cancers, and had less cardiovascular disease. These are facts. These are facts. No periods in 2 years. Too late. No. Go to your doctor. Demand the conversation. Demand the conversation. Okay? Demand it. God, I have so many articles. I have blogs about this. Go print out the stuff I'm giving you. Print out this article. Take it to them. Educate them. It's okay to educate your doctor. It's totally fine. Doesn't look like statins are doing much for women. Yeah, they might lower your cholesterol, but they are not decreasing your risk of dying from a heart attack. They are not. Not for a woman. Okay? Let's see. Let's see. My mom didn't tolerate hormone replacement therapy, made her very sick. Will the same happen to me? Absolutely not. The doses have changed. You have multiple options, and you have half of your father's genetics. Don't use your mother's experience as a way that not allowing yourself to at least consider the option. So, yes, if you don't have, I see this question all the time. If you don't have a lot of menopausal symptoms, so 20 years ago, we only used hormone therapy for women with symptoms. It was to control their symptoms and make them feel better, okay? That is not the case anymore. Hormone therapy is preventative. It is a medically necessary preventative medication to keep you healthier in the long run. We're simply replacing what your body has stopped making, okay? You can choose not to have it, but your risk of death, your risk of dying, your risk of cancer, your risk of cardiovascular disease, is going to be higher than a woman who chooses to take it. These are facts. So is 65 too late to get started? No. Its doctor has not kept up with the latest studies. That is what they were taught 25 years ago, but there's tons of new studies and information that have come out. Women have been pushed to the sidewalk. I mean, women are suffering needlessly. They've been pushed to the sidewalk. They've been pushed away, and they've been ignored. They've been told they're crazy. I am done. I am fucking done with all of this. I am done with you being sidelined and marginalized and your health not being brought to the forefront. I am fighting day and night to spread information, to arm you with as much information so that you can be your own healthcare advocate. So we need to re-educate our physicians. I am trying to create a database of menopause-friendly providers who, like me, who have kept up with the latest information, who are passionate about taking care of you and giving you therapy, offering you therapy, which you may refuse, which is absolutely your right. But my God, you need the conversation. You deserve a conversation so that you can make the choice as what works for you. And I am not ignoring exercise and nutrition. That is my passion. That should always, always, always come first. But I am on hormone replacement therapy. Yes, my hot flashes were horrible and it totally helped. But I'm on it to decrease my risk of cancer and death as I get older. The end. Okay. But it does not increase cardiac risk. It does not in the general population. It does not. Let's see. So if you just don't know who I am Dr. Mary Claire Haver. I am in my pajamas and I'm having coffee and I am sharing. I live in Texas, in Galveston, right here. And I have a clinic in Texas if you want to come see me. So if you're looking for information on perimenopause, go up to Dr. Mary Claire. Oh, 33,000 likes. Let's get a few more. Everybody double tap my face on the screen like this. Just go up and just double tap my face. Boom, 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 boom. And that will give me likes. That will help me to stay relevant on this platform. And thank you so much. So everybody tap the screen 10 times. So help with weight gain and perimenopause. I got you, girl. I got you. So go to up here this will take you to my TikTok page. There's a bolded link at the top. Go to my link in bio. Check out the Galveston diet. It is not a diet. It is a lifestyle change. It is a way for you to grow old healthy. When my patients come to me in clinic, the Galveston diet and all of our resources are part of our training. I also do individualized nutrition program. I do exercise recommendations. I also do medications. We do a lot of counseling. I try to give as much information as I can and set them on a course. Not that they're going to, women who come to me and want to see me in clinic very rarely are like, I want the body I had at 25. That ain't happening. Okay? They come to me because they want their old lady body. They want dense bones, strong muscles, and to be able to fucking think. Okay? They don't want to lose their minds as they get older. They want to avoid Alzheimer's and dementia. They want to be able to lift up grandbabies. They want to be able to climb mountains. They want to be able to do the things they've worked their whole lives to do. They are running away from their genetics as fast and as hard as possible. They are scared to become their parents. They do not want the loss of brain function, the loss of mobility, the loss of being able to take care of themselves. And this is the course that I put them on. And yes, hormone replacement therapy or menopausal hormone therapy is part of that. But you cannot get out of this life not paying attention to your nutrition, not paying attention to your exercise, not paying attention to your mobility, not stretching, not working on balance. It's all part of the package. So, guys, the questions are flying in left and right. I'm doing my absolute best. So if you would like to share this video, there's a little button down here that allows you to share the video. And what to do for no libido, it depends. So let me do a quick and brief overview of sexual function in women, okay? I hate calling it sexual dysfunction. There are 5 reasons why a woman is not satisfied with her sex life, okay? All right, number 1, she and her partner do not care about each other. There is abuse, there is no connection, there's no emotional connection. Okay, so that's number 1. So if that's happening, you don't have to worry about the other 4. That's the first thing you need to fix. There's a relationship issue, and that is nothing medication is going to do for you. It's not going to make you want your husband more. It's not a hormonal thing. This is a connection thing, and it's not happening for you. Okay, so what are the other 4? Now we're moving into the medical world. Okay. Number 1 is desire. There is a desire issue, okay? Desire is in your brain. Desire is up here. It has nothing to do with your pelvis, okay? Hormones can have effect up here, but there is a desire issue, meaning you want to have sex. You want to have desire, not have sex. Desire is different than sex, by the way. A woman's sexual pleasure often has little to do with penis and the vagina. PIV sex, okay? So you want to have desire, but it's just there's a roadblock there. That is a mental thing, okay? Counseling can go a long way here. Medications can help here. There are medications that can change the neuroreceptor levels at the brain that can make you more receptive. Sometimes testosterone can be helpful in a postmenopausal patient, but again, that is limited, okay? So desire disorder. There is an arousal disorder. Arousal is what happens in the pelvis. Your brain is like, okay, I'm here for this. Let's do this. But nothing's happening in the pelvis. You're not getting the increased blood flow to the vagina. You're not getting the increased mucus to the vagina. You're not getting the lengthening of the vagina. You're not having the physiologic response to desire, which is arousal. Okay? That's not happening. That is a medication problem. Okay? That we can help with medication. You have an orgasmic disorder. Do you know that 15 to 20% of women have never had an orgasm in their lives and never will? If that happened to men, it would be a fucking national emergency, okay? There's no research being done on this. It's all in your head. You're crazy. Just lay back and do it. Here's some wine. I'm not okay with this. So orgasmic disorder, or you used to have orgasms and now you can't. Sometimes it's a nerve conduction disorder, like in a diabetic, or you've had surgery and they cut the nerves there. I mean, like there's a lot of reasons why this could happen. The nerves are damaged for some reason. So you have MS. I mean, these are all things. You've had a spinal cord injury. So finally, there is a pain disorder. If it hurts, no one wants to do it. We have to fix the cause of the pain. It could be dyspareunia from a million different things, but for most of us at this age, there is a component of atrophic vaginitis, atrophy in the vagina, where the vagina is losing its estrogen, which is making, so when we lose our estrogen in the vagina the walls become thin, they become very, very easily injured, you lose elasticity, you don't make mucus, and it's horribly, horribly painful. Who wants to do things that are painful? Most people do not. Your body is like, avoid, I don't want to do it, The easy fix for most vaginal atrophy is vaginal estrogen. And less than 20% of patients who are suffering with vaginal atrophy and it's affecting their mindset about everything are not being offered therapy. The first thing they're offered, well, you go home and have wine. Really? To fucking fix pain? Are you fucking kidding me? Excuse my language. I get a little passionate. Number 2, then they get offered an antidepressant. You're not depressed. You're having pain. Oh my God. Okay. Finally, they get offered vaginal estrogen. Finally, somebody, ding, 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 yeah, give her what she needs. It's $400 at the pharmacy. Okay, do you know how much Viagra is? $15 a month. Do you know how much vaginal estrogen is for estradiol? For bioidentical. If you go get it from the pharmacy. $400. Okay, maybe you can find the pill, the vaginal estrogen pill, the Uvifem, for $50. But still, why? Why does this happen? Because it can. Because no one is standing up for women's sexual health in the places that it matters, in the places where the costs come down, okay? We have got to take control of this. We have got to fight. We have got to elect officials who have women's health at the forefront of their agenda. Make this happen, people. We can do it. We can do it. We have to stop electing officials who don't give a shit about women, who don't give a shit about women's health, who are only interested in power and money and all the things, and that's on both sides of the aisle, Okay, I'm not pointing out one stupid party versus the other. Find people who have your best interests at heart. The Q&A box has been taken away, guys. I am so sorry. The Q&A box in the lives, I don't have it anymore. I don't know where it is. If you know where thank you for the gifts, guys. Thank you for the hand hearts. Thank you for everything, and keep liking this video. We're up to 57,000 likes. Okay, so best supplement for beginning menopause. It depends. Remember, guys, I'm a nutritionist, so I'm a medical nutritionist. You only supplement when there's gaps in your nutrition. So you need to be tracking what you're eating. My favorite tracking is Chronometer. Link is up here at the top of my page. You can go check it out. Let's see. Thank you for the hand hearts. Thank you so much, guys. Is there a limited time to take HRT? I'm gonna stay on it forever. That's me. Don't get me started on the cost on women versus men. I hear you, sister. The pink tax in women's health, women's sexual health, is absolutely ridiculous. And the only reason they're doing it is because they can. Is it possible to rebuild muscle? Absolutely. Absolutely. You need to make sure you're getting enough protein, and you need to be doing consistent resistance training where your weightlifting is getting heavier, where your resistance is getting heavier over time. Okay. Thank you for sharing the video, guys. I so appreciate it. And thank you for following me. This means everything to me. It keeps me relevant on this platform. And thank you for all the likes. If to like the video, you just tap my face. You just tap my face 10 times, and then you'll see the little hearts pop up. I really, 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 really appreciate it. At what age should you start HRT? The earlier, the better. I would start in perimenopause and continue at least until 60, at a minimum until 60 years of age. You said HRT prevents cancer, but other doctors have said the opposite. Okay, they have not kept up with the latest studies. I have receipts, okay? I have receipts. I have multiple articles proving this. Guys, they're not keeping up with the latest. Like, since 2018, there's been multiple articles that show a decreased risk in all-cause mortality from cancer, from HRT. These doctors get out of training 20, 25 years ago, and they are not keeping up with the latest information. It's just easier for them to just toe the line of what they were taught 25 years ago. It's easier for them not to prescribe HRT, but very, very soon, most likely, you will be able to sue your doctor for malpractice for not opening the conversation because they put your life at risk by not offering you hormone replacement therapy. That is how dramatic this change is. I'm telling you, I'm not making this up. Let's see. How long does it take HRT to work? You've been on 3 months, no different. What are you looking for? Like there's symptoms. Like, it takes about 3 weeks for the hot flashes to get better, but what are you treating? Remember, you're not going to feel your cholesterol getting lower. You're not going to feel your risk of heart disease getting lower. You're not going to feel your risk of cancer getting lower. You're not going to feel your bones getting stronger or staying strong. Those are things that you're not going to notice. They're just happening in the background. Okay. Yes, it's happening. I do not see any signs of turning back. 48 years old. So if you think you might be perimenopausal, so if you are older than 45 and you haven't had a period in over a year, it's an over 90% chance that you're postmenopausal. If you're older than 35 and your cycles are becoming irregular, and you're having hot flashes, and you're having new joint pain, and you're having increasing headaches, and you're having increasing mental health disorders, and you're having increasing inflammation, and you're gaining weight in your midsection where you never had before, it is almost 100% that you're perimenopausal. I have a validated by science perimenopause quiz linked to my page up here. Oh, 70,000 likes. Thank you, guys. Double tap my screen to like the video. If you go to Dr. Mary Claire, up here at the top of my TikTok page, there is a link to my link in bio. And my link in bio has a perimenopause quiz, absolutely validated. It will tell you the percent chance that you're in perimenopause. At the end, it will ask for your email because I'm going to send you stuff you can take to your doctor to begin a discussion, treatment options, information, free for you. Okay, because passion, yes. I make money selling diets, yes. I'm totally honest about that. I do sell a few supplements that helps feed my family. That's how I make and I also have a clinic, okay? That's my job. like to support my family. The rest of this information is free from me to you. So I can't be your doctor in Oregon. You know, I can't go up there and practice medicine. I'm not licensed to do that, but I'm giving you free information to arm you, to be your advocate so that you can have a better health outcome for the rest of your life. So I am located in Texas. I have patients from out of state every week who travel to see me. A lady came from Wyoming on Tuesday, flew to come and see me. A lady flew from Hawaii on Wednesday to come and see me. That was her choice. I am menopause at 33, girl. You should talk to your doctor about HRT. I'm outside of Houston in Friendswood. I'm just outside of Houston. I have people driving from all over Texas to come and see me. What is the credential for menopausal doctors? So not really. I mean, board certified OB-GYNs like myself receive very little training in menopause and the nuances of HRT and menopause therapy, especially the ones who were trained in my generation. I finished my training in 2002. So 22 years ago. 20 years ago. Huh? Yeah. Math. So my generation was not trained in the nuances of how to diagnose perimenopause. The WHI was rocking our socks off, the Women's Health Initiative, and so we were taking everyone off of hormone therapy at the time because of the supposed risk. That study's been blown out of the water, completely disproven. So it led to 20 years of women being dismissed, ignored, not offering any treatment, and dying earlier, having more cancer, more cardiovascular disease, and being less healthy. Okay, we fucked women for 20 years. I'm done with that. I'm not doing that anymore. And I am fighting for all of you to try to educate as much as possible so that you can be a better advocate and actually maybe educate your own doctor. Okay, so until everybody in the training programs catch up, it's going to take another 20 years. So we got about 40 years of a blown out of proportion study we have to undo the damage from. So, didn't get much feedback from her. She said, we know from your doctor. I'm sorry, sweetheart. A lot of doctors have no idea what perimenopause even is. They don't think it's a thing. So what has your doctor told you? I want to see in the comments. Show me in the comments what your doctor, what the crazy ass shit, when you go in, I'm like, look, I'm not sleeping well. I'm having depression. I'm gaining weight in my midsection. Tell me what your symptoms were and what your doctor said to you. I want to know. I want to hear. Let's see. Do you think? Oh, that's normal. Yeah. My doc says the lack of desire is all in your head. Okay, fire that doctor immediately. That's malpractice. I'm being offered to go live with some weirdo. No, thank you. Bye. Totally ignored your symptoms. The UK doctors aren't helpful. There are some good docs in the UK, I promise. There's a couple on my list if you want to go check them out. He said, yeah, you're getting older. But why? I mean, okay, so yeah, these are age-related processes and specific to women, but why suffer? Why? Just because it's normal just means, all normal means, guys, normal means it happens to a lot of people. That's all, okay? It doesn't mean it's not pathologic. It doesn't mean it's changing your quality of life. It does not mean that you are not eligible to feel better and live healthier and live better. The end. Okay. Insomnia, constipation, bloating, weight gain, fatigue, gave you a script for Lexapro. Okay, Lexapro might help with a couple of those things, but it's not treating the root cause, which is menopause. Okay, the root cause of all of this is menopause. No HRT due to DVT. You are a candidate for transdermal more than likely. Talk to your doctor. Pull the articles on transdermal and risk of DVT. So just because you couldn't take birth control pills does not mean you can't take hormone replacement therapy or vaginal estrogen. Let me say that again to those of you in the back. Just because you were told you could not take birth control pills does not mean you are not a candidate for hormone therapy in menopause. It's a very different dose. It's a very different formulation. You might still be a candidate, okay? Doctor only offered antidepressants. So sorry, guys. So sorry. Antidepressants can go a long way to help with a lot of things, but it is not treating the root cause of menopause. Hi, your menopause 7 years now. I am having pink discharge. Doctor ordered an ultrasound. That is good treatment. You should have an ultrasound. That's absolutely right. Does hormone replacement therapy help with weight gain and the digestive issues? Hormone replacement therapy is better at helping with the body composition changes. So when I say that, if you know what I'm talking about, body composition changes are when you have fat deposition in new places, okay? And for most women, not all, so this is excluding people with polycystic ovarian syndrome and apple shapes from all their lives. Women who tend to, and this is most women, gain weight in their hips and thighs, okay? So these are women who don't suffer from insulin resistance, okay? That's a separate group. So if you don't have insulin resistance, young in your life, and all of a sudden you are noticing you are gaining weight in your midsection. You're gaining weight, but you're mostly getting a gut that you never had before. That's a body composition change, where your body deposited fat has changed. That is helped with hormone replacement therapy. So I want to be very clear about that. Your waist-hip ratio is everything, guys. It's a more accurate predictor of health than your weight or your BMI, okay? The waist-hip ratio. And there's stuff on my website all about that to learn about waist-hip ratio and how to measure it. Let's see. They said, here you go, take Wellbutrin. Nice. Low libido anxiety. Doc said low hormone level, but no need for meds. Still having issues. Age 43. I mean, why do they find a new doctor? They need to be addressing this and offering you treatment. Inner ear itching, yes. So dramatic changes in dry skin, increasing dry skin in menopause for most women. And the dry skin and increasing irritability of the nerves, and that can lead to itching. My itching is in the middle of my back. I have this weird middle of my back itching since menopause, and my skin is a lot drier. I used to have acne. I never worry about acne anymore. My skin is I had to totally change my skincare regimen, totally change my makeup routine because my skin has dried out, even with hormone replacement therapy. HRT goes a long way, but it does not reverse all of the changes of menopause. So it's simply slowing things down. It's simply slowing it down so I can live a healthier, happier life with less symptoms. So is the estrogen patch safe? Boy, I sure hope so because I'm using it. I like transdermal forms of hormone replacement therapy, and my personal choice for me was a patch. That's what I use. Do I take insurance? No. Insurance does not pay for all of the labs that I run. Insurance does not pay for the hour that I spend with a patient. I schedule an hour time and a half an hour on follow-ups with my patients, like a whole hour of talking, discussion. What do you need? What do you want? Coming up with a plan, formulating it, typing it out, giving it to the patient. When I do a plan, the first thing is nutrition. The second thing is exercise, nutritional goals, exercise goals. And then we do supplements if we feel like they need them. Then we do prescriptions if they need them. It's a whole package. It's a whole package, and it takes an hour. So insurance doesn't want to pay for that. I do an extensive blood test profile, okay? And I don't always do hormones. I don't need a woman to prove to me that she's perimenopausal or menopausal. I usually can talk to them and be able to tell. Let's see. Trigger finger menopause related. Definitely frozen shoulder is for sure. Trigger finger, anything that's inflammatory or causes contractures that I don't know what trigger finger actually is. I know frozen shoulder is contracture of the glenohumeral joint because I looked it up the other day and did a TikTok about it, which went viral. Who knew? But what are my thoughts on bioidenticals? Okay, so bio or body identicals are simply things with estradiol. Estradiol, estriol, and estrone are the three hormones that are made naturally in the body. Synthetic is ethinyl estradiol, okay? And then there's conjugated equine estrogens, which is what's in Premarin. There's three kind of forms of estrogens out there, okay? So there's the synthetic, which are made in the lab. Now, the bioidenticals are plant-based usually, but they are heavily chemically processed in the lab to extract it from the plants, and they have to make it available to the body. So don't be thinking you can just go munch on a bunch of soy or plants and think that you're going to get the same benefit. Or that your bioidenticals are all natural. They are not. They are heavily chemically processed in order to get them into your body. The end. Okay, so there's ethinyl estradiol, which is in almost every birth control pill. So those of you who were on birth control pills for 20 years, you were on synthetics and you didn't die, okay? So then there's body identical, and then there's for estrogen. And then progesterone, there's the progestins, which are synthetic, and then there's progesterone. So for my patients, if they do the combi patch, which is what I on, the estrogen is body identical, but the progestin is not. To do that, I would have to do an estradiol patch and then take an oral pill. I'm so bad at taking the pill every day, and I don't react well to the oral progesterones. I know because I had to take them in high doses to get pregnant, and my body, I had dizziness, lightheadedness, nausea, bloating, diarrhea. I mean, like, my body was like hell to the no. I actually do better on synthetic progestin. So that's what I take. You know, again, a lot of your hormone replacement therapy is trial and error. We have a lot of options, but don't go down the road thinking I absolutely have to do X, Y, or Z. We can play around with it and find what's going to work for your body the best, So everybody wants to know about pellets, you guys. Okay, so here's my quick and dirty on the pellets. It's just another form of HRT. It is not safer, it is not better, it is not, and the testing is not there to support their widespread use. They are outlawed in the UK. No one's on pellets in the UK because they don't allow them. They feel that they are dangerous. The North American Menopause Society does not recommend them. Neither does the American Council of OBGYN. Okay? They say no pellets. Now, if you're doing well on your pellets, you're happy on your pellets, stay on your goddamn pellets. However, you can find alternative forms of hormone replacement therapy that don't cost you so much money. Remember, it's a cash cow. It's a profit center for your physician, and that bothers me a little bit, okay? I just give my patients prescriptions. They go to a pharmacy or a compounding pharmacy, and they get them filled. I am not involved in making money off of that, okay? You pay me for my time, for my visit. I don't want to make money off of selling you drugs, okay? That makes me uncomfortable. So pellets, why does England, why does the UK outlaw them? Why does ACOG say hell no? Why does NAM say hell no? Here's why. Because compounding, it's a compounding. So these, compounding used to be a little guy in a pharmacy down the street, and he would like, what you needed was not available from a prescription. So he'd be like, I'll make it for you. No, here you go. In small batches. So these labs got a whole, these big labs were like, oh, we're going to compound so we don't have to follow the FDA rules. Compounding pharmacies are not tested by the FDA. Compounding pharmacies do not have to do internal testing. Turns out that these so the top 12 compounding pharmacies that make pellets, FDA went secret shopping. This is all published information. You can go find it yourself, okay? They went secret shopping, and they said, we got to test these. A lot of docs are using them. A lot of docs are making a shit ton of money off these patients. So the doctors buy the pellets wholesale from these labs, and then they stick them in your body, okay? And I'm not saying all doctors doing this are bad. I got friends who do it. I'm not, I'm just like giving you the data. So FDA went and tested the top 12 labs. 34% discordance, meaning what they said was in the pellet was not actually in the pellet. Now, the actual medication that they said was in there, but the percentage strength was a 34%. That ain't what's in there. Their percentages are off. When you go to the pharmacy and you get Climera or Prempro or whatever, it's a 2% discordance. So you do you, but I'm telling you, one, it bothers me that it is a cash cow for a lot of, I see these clinics popping up on the highway out here, all Her Care and whatever, and it's just a chop shop. You go in, it's some mid-level provider, not that all mid-level providers are bad. I go to a mid-level provider, but it's someone with minimal training, no expertise in OB-GYN, no expertise in menopause. They go through a little book, check this box, and then throw those pellets in. They're making a shit ton of money, and you're not being monitored properly. No, it just bothers me. Okay, so you do you. Good luck, but people are being exploited. It's an easy thing to exploit and make a lot of money off of. So that is my 2 cents on that. I don't use them. Because I have other options to help my patients. So, okay. Double tap the screen to like the video. Everybody, we're going to get to 100,000 likes here. We're at 90,000. Yeah, lacking consistency by compounding. They're not being tested. They don't have to test. So it's a cost, What patch do I use? My personal patch. Again, this is me. I use Combi Patch because I'm not blanket recommending Combi Patch for everyone. I use it for specific reasons, specific to my needs, my wants, my reactions, my allergies, my whatever. That's me. You have options. So when I sit down and discuss with a patient, they don't all walk out with the same thing. We discuss cost. We discuss needs. We discuss habits. We discuss how dry is your skin. The patch may not stick. Maybe a pill might work. We discuss risks, benefits. They're all different. So 43, feel like you're going crazy. Your anxiety. We definitely see anxiety getting worse in perimenopause. Absolutely. Okay, do you want to, I wish I could flip the screen. Okay, I just did a talk. I have a flip chart on HRT options. Do y'all want me to do it? Okay, so I'll have to stop this live and go to another live so I can flip the screen and show you guys. Do you want to do that? Yes or no? Let's see. Let me go get the screen. I'm in my pajamas, but they cover all the necessary parts. Okay. Let's see. Yeah, it's backwards. I gotta figure, I can't flip the screen mid-video, so I'll have to stop the live. But I just did. So we had a whole team meeting for my Galveston Diet and the Pause team. So doing strategic planning for the future. We're coming out with all kind of amazing stuff. So, but I'll do my little HRT tutorial for you guys. So everybody double tap the screen to like the video while I find this. As far as what kind of HRT is out there. Hang on. Let me get to, here it is. It's under here. Okay. So give me a sec. I will do this for you guys, but I'm going to have to jump off of this live and start another live. Okay? Oh, 100,000. Woohoo! We did it. All right. So here we go. Menopausal hormone therapy. So let me get this set up so I can go through all the options with you so that you can be a better advocate for your with your doctor. Okay. Yes, please. Okay, so I'm going to jump off and then just stay tuned. Look for the new live, and I'll flip the camera around so I can do this talk for you guys and set it up right.